Good morning, everyone. I am so glad to be here. I'm Denise Johnson, Acting Physician General at the Pennsylvania Department of Health. So the 2021 flu season started on Sunday, September 26th, and although we know that we had a really mild flu season last year, this year is really full of a lot of unknowns. It's really hard to know from season to season what we're going to be seeing in terms of flu. Last year, we're in a really different position. We were doing all of the safety measures. We were socially distancing, washing our hands, masking. And in Pennsylvania, we had less than 4,000 cases of flu that were reported. Typically, in the flu season, we see more than 131,000 cases of flu. So really, really quite different, and really hard to know what to predict this year. Right now, again, we're in the flu season, and so it's really recommended that anyone 6 months or older, as long as you're not allergic, get your flu shot. And it's important to get that before the flu season really kicks off and before the flu season really comes to your community, so that you're protected, for you, your family, and those around you, and even for healthcare workers who are going to be taking care of you. The people who get the flu shots, if you do get the flu, those illnesses are milder, and it really can prevent hospitalizations. We know that the flu is still deadly. Many people die every year from the flu, and so getting that vaccination can really protect you. Also want to remind people that this year we are going to have COVID-19 and flu both circulating, and so that these are different viruses, and so getting the flu vaccine doesn't protect you against COVID, and getting the COVID vaccine doesn't protect you against the flu. Flu and COVID, those symptoms can be different. Some can be the same. People with flu often notice that they have fever, chills, they can have cough, they can have body aches. Some people have diarrhea with the flu. With COVID-19, we've seen people have fever as well, cough, shortness of breath. Some people have new loss of taste and smell. And so it really is difficult to tell whether or not you have flu or have COVID-19. The only way to really tell about that is to be tested to see what you have. We really recommend, of course, if you've got symptoms, that you really stay away from others. Gone are the days where you can have the flu or flu symptoms and still go to work and out in public. You really need to be tested. For the flu, the vaccine is the best protection again. People can have treatments early on with antiviral therapy for flu, but again, you want to make sure that you're tested and know whether or not you have flu or COVID-19. So today, I'm going to be receiving my flu shot. I've already gotten my COVID vaccines, and I'm going to turn it over right now to our Deputy Secretary, Ray Barashansky, to tell you a little bit more about getting those flu shots. It's very safe right now to go to your pharmacist or healthcare provider to get your flu shot, and we recommend those for everyone. Thank you.
Good morning. Thank you, Dr. Johnson, and thank you to UPMC West Shore and Dr. Goldman for having us here today. My name is Ray Barashansky. I'm the Deputy Secretary for Health Preparedness and Community Protection at the Pennsylvania Department of Health. At the Department of Health, every year we update our flu data on health.pa.gov. Those updates will begin on Tuesday, October 12th, and they will occur every Tuesday throughout the flu season. And this data typically includes a summary on where and when flu activity is occurring, current trends in flu as compared to previous seasons, and what types and subtypes of influenza viruses are currently circulating. The Department of Health's epidemiologists have already begun monitoring flu activity. We're also prepared to stand up a multidisciplinary working group comprised of both internal and external partners to quickly respond to increased flu activity over the coming winter months. Internally, we have members from our Bureau of Epidemiology, our Public Health Laboratory, our Bureau of Communicable Diseases, our Bureau of Public Health Preparedness, and of course our Office of Communications involved in that working group. And externally, we've had members of the Hospital and Health System Association of Pennsylvania, or HAP, the Pennsylvania Medical Society, and the Pennsylvania chapter of the American Academy of Pediatrics. This working group is prepared to meet regularly to discuss flu trends as well as what we're seeing specifically here in Pennsylvania and any relevant guidance from the federal government. You can work with us too. Like Dr. Johnson said, now is the time to get your flu vaccine to protect yourself from the flu virus. And while they're offered at doctor's offices, pharmacies, walk-in clinics, and even grocery stores, there are also seasonal flu clinics distributing the flu shot to anyone ages 6 months and above to protect against the flu. A full list of upcoming clinics is available at health.pa.gov. And right now we have clinics listed in Allegheny, Chester, Erie, Montgomery, and York counties. Thank you. And I would like to turn things over now to Dr. John Goldman.
Thank you, Dr. Johnson and Deputy Secretary Bereshensky for joining us here today at UPMC West Shore to discuss the flu season and what our community members can do to help control the spread. As has already been mentioned this morning, we cannot emphasize enough how important it is that we each do our part to protect not only ourselves, but our loved ones, family members, and the community from the flu. As our communities start to relax COVID-19 containment measures, such as masking and social distancing, we're seeing resurgence of other respiratory virus, which does not bode well for the flu season ahead. In a worst-case situation with a highly transmissible flu strain dominating and low influenza vaccination uptake, University of Pittsburgh Graduate School of Public Health predictive models indicate that the potential for up to nearly 500,000 more flu hospitalizations this winter compared to a normal flu season. Vaccinating as many people against the flu as possible will be key to avoiding this scenario. Healthcare workers across the region, state, and nation have been working tirelessly for over 18 months, now battling the COVID-19 pandemic, and these predictive models are concerning. I want to take the time to acknowledge my colleagues here at UPMC and healthcare workers across the state and nation for continuing to not only meet but rise above the needs of our communities. We've been through so much physically and emotionally, and you continue day in and day out to provide the highest quality care to our patients. Thank you. Community members, there's something you can do to help our healthcare workers. It's simple, safe, and effective. Get your flu vaccination. Stay home when you're sick, and wash your hands. Influenza vaccinations are readily available in our communities. Echoing what has already been said this morning, it is safe to go to your doctor's office, pharmacy, local walk-in clinic, or grocery store to get your flu vaccine. It's important to act now before the flu season picks up so that you are protected. While the flu vaccine does not guarantee you will not get the flu, it helps your body build immunity to fight the flu. This helps reduce the severity of your illness, and most importantly will help reduce the likelihood that you will need hospital-level care for your illness. And in fact, high-risk patients, people who are older or have other medical conditions, their risk of dying during the flu season actually goes down by roughly half. On a personal note, I'd like to share that I have already had my flu vaccination, and I hope you will join me in getting yours this flu season. In addition to the information that has already been provided here today, I'd like to add that UPMC providers are scheduling flu vaccinations through our primary and urgent care clinics. All it takes is a quick call to your provider's office or a quick web search to see where else flu vaccines are available in the region. This is our best shot at controlling the spread of the influenza virus this flu season. For more information on flu vaccinations at UPMC, visit upmc.com/ /flu.
We'll transition into the flu shots now. So give us a minute to set everything up, and then we'll get it set again.
Thank you so much.
Oh, thank you.
Yeah, we really appreciate your participation and
My pleasure.
advocacy.
Yes, my pleasure. Actually, when I went to do one of the things.
I'm here for you, Colin.
Can I help you? Is that all right? Sure. Actually, you have a shirt on now.
You're welcome. I did this for you.
I know you did. See? That's why I didn't want you to pass out.
Okay, now you're freaking me out. Yeah, but then again, I have a position standing right here. So if I say something too complicated, I'm not going to
Oh, no. As a physician, he's
I'm
like,
getting
not
it. No,
saying
I'm just getting you in the right spot.
Okay.
I'm getting him up high enough on this shirt.
Is that good? You want me to pull that up more?
No, I'm trying to think. We probably don't want your hand there because
Yep.
I think optically.
Mm-hmm.
We're gonna get you up. We
I
have.
might as well go first since we're early. Like, this is like,
Since we're jamming his shirt up
this is
here.
not the theater of the absurd, but Colleen's got a great sense of humor as opposed to
Yes.
Ray.
So I think
This
we'll
is
be
all
all
very
right.
bold of you, Colleen, doing this
Yeah, I
on
was
camera.
just gonna
But,
say.
So what do you think I can keep that up?
I can.
Yeah, you might have to.
Yeah, how about that?
Guys, if he helps hold his shirt up, is that okay?
You sure?
Yeah.
Is that gonna be all
As long as
right?
they can see the shot. Yep.
I would love to have you say something while I'm going.
Is that okay?
Want me to hold your hand?
That would be great. Do you have a candy?
I
You
know,
know,
just
lollipop
want a
when you come.
lollipop, yeah.
That would be nice.
I think Colleen could give you a sticker.
I appreciate that. That's kind. How long have you worked here, Colin?
Yes, yes.
Okay. Got it. That's amazing.
Okay, so you're gonna go through the process then, Colleen. You're good to go.
You're so
Okay. You guys all ready? She's good to go. Okay.
my niece is actually a very practicing practitioner at Georgetown. Yeah. Very medical family. That's the best way I can put it. You good? Yep. 30 years, huh? Had a great career. Well, look at you. Sounds good. Should I hold it? You got it. So, what was this on?
Colleen, they should be doing a video for like your Facebook page or something like that. So we told the vaccines to your cousin. I know, especially early on. Wasn't that so rewarding? Because people so happy to get them. Mm-hmm. Yeah. I did vaccines at our organization. We didn't do varsity clinic, but especially when we did the elderly, a lot of people couldn't come in. So
All right, great. Thank you, Colleen and UPMC West Shore. I'm now vaccinated against the flu, and we would be happy to take any questions that you have.
For Dr. Johnson, are you concerned with any low vaccination rates for staff at any or any nursing homes, and the fact that so many nursing homes did not meet the 80% goal set by the state?
Sure. Well, we continue to work with nursing facilities to facilitate vaccinations for them. I know that right now, due to the community spread, the high level of spread that we have, nursing homes are also continuing to do testing. But we have teams that are helping them in terms of getting education to them and making sure that they have vaccines provided on site.
Thank you for that, ma'am. To the group, what are your thoughts on the move to get emergency authorization for a booster shot for the Johnson & Johnson vaccine?
Do you want to take that one?
I personally think it's a good idea. There has been gradual waning of efficacy in vaccines, more for breakthrough cases than for hospitalizations. There has been some waning in people above the age of 65, particularly with high-risk conditions. And so I personally feel that the booster shots are a good idea. I don't know that we have enough data to make a firm recommendation, but I personally will get one as soon as I've gotten one, and my parents who are older will get theirs as soon as possible. So my gut, more than my hard science, thinks it's a good idea.
Anybody else want to comment on that? Yeah, okay. Thank you.
Any other questions? All right, well, thank you all for coming out, and please get your flu and COVID-19 vaccines.
Thank you so much.